Hello, thank you for visiting Children's Emergency at KK Women's and Children's Hospital. Your child has a cough, cold, or other symptoms of an upper respiratory tract infection. We have put together this video to help you understand more about how to care for your child during their illness. In this video, we'll talk about upper respiratory tract infections or URTIs, common treatments, when you should seek medical attention, and how to prevent these common infections. Coughs and colds are common in young children. Children may have 6 to 8 viral infections associated with cough every year. Your doctor may refer to these illnesses as upper respiratory tract infections or URTIs. Your child may be experiencing the following symptoms: fever, blocked or runny nose, sneezing, sore throat, and coughing. Although it's upsetting to hear your child cough, it is important to remember that coughing is a protective reflex that helps to clear excessive mucus from the nasal passages and airways. Children also cough because of mucus trickling down the back of their throat, especially when they're lying down. Some children may be able to cough out their phlegm. Children who are not able to cough out their phlegm usually will cough and swallow the phlegm into their stomach, which they then pass out in their stool. In general, the cough usually peaks on the 2nd or 3rd day of the illness and will gradually improve over the next 10 to 14 days. Most coughs do not require a chest x-ray, as the cause can be worked out through reviewing the history of the cough and examining your child. The doctor will order a chest x-ray only if it is needed after evaluating your child. The treatment for a cough depends on the underlying cause. Most coughs and colds are due to viral infections and will improve with time without any treatment. Cough medications are only for symptom relief and do not cure the child with a cough or cold. They may not help a child recover quicker and can have serious side effects. Many cough medications are not recommended for children under 2 years of age. For a mild cough or cold, it may be better not to use any medications at all. You can help your child feel better by ensuring that they drink plenty of fluids, especially warm drinks to help soothe the throat. For children over 1 year old, a small amount of honey diluted in a warm drink may also help soothe the throat and relieve the symptoms of a cough. You should also ensure that your child gets enough rest. If the symptoms are distressing for your child, your doctor may prescribe these medications. Nose drops and nasal sprays are often the only medication that a child with a cold or cough will require. Decongestant nose drops shrink blood vessels in the nose, reducing swelling and allowing for easier breathing. These nose drops should not be used for more than 5 days continuously to avoid a rebound effect when nasal congestion may worsen. Saline drops or saltwater sprays may also relieve symptoms by moistening the nasal passages and loosening mucus. Antihistamines dry up secretions and help relieve blocked and runny noses. Some antihistamines may also help suppress cough. Antihistamines, however, can cause drowsiness, agitation, and even breathing difficulties in young children and should be used with caution. Mucolytics thin and loosen mucus in the airways so that it is easier for your child to cough out. However, this may lead to more frequent coughing and vomiting after coughing. Antibiotics are used to cure some bacterial infections. They do not help in most instances, as coughs and colds are commonly caused by viruses. They are only prescribed if your doctor suspects a bacterial cause for the cough. If your child is well apart from the cough, your child can probably be managed at home. However, there are situations where you should bring your child with a cough to the doctor. In these cases, the doctor will need to exclude other, less common causes of cough, such as asthma or bacterial infections. Consult your doctor if your child has difficulty breathing, rapid breathing or noisy breathing, has phlegm with blood in it, complains of chest pain, is lethargic, drowsy or irritable, has poor feeding or signs of dehydration, such as not passing urine for 8 hours, dry lips and tongue, or no tears when crying. If you suspect your child has choked on any object, if your child has prolonged symptoms such as a fever lasting 5 days or more, or a persistent cough lasting 2 weeks or more. Finally, you should also see your doctor if your child has any abnormal or prolonged symptoms which concern you. You may consider the following measures to prevent upper respiratory tract infections. Maintain good hygiene by keeping your child's hands clean through frequent hand washing and the use of alcohol-based hand sanitizers. You may also teach your child to avoid touching their mouth, nose, and eyes. Yearly influenza vaccines can help prevent infection by some of the influenza viruses. Avoid exposing your child to smoking and secondhand smoke, as these can negatively affect your child's natural ability to fight against respiratory infections. Finally, ensure your child has a healthy diet, enough sleep, and exercises regularly to help improve their immune system. Key points to remember from this video are: children may have 6 to 8 upper respiratory tract infections in a year. These infections are commonly caused by viruses. Coughing is a protective reflex that helps your child clear excessive mucus from their nasal passages and airways. Most of these symptoms resolve with time and do not require any specific treatments or medications. Ensure your child drinks sufficient fluids and gets plenty of rest to help them recover. Bring your child to a doctor if you notice your child having any of the warning signs we explained earlier. We hope you feel more confident in looking after your child after watching this video. Do also refer to the pamphlet given for further details.